have here Dr. Frieda Birnbaum, who is a psychologist and a psychoanalyst, and she's an expert on depression, and she's going to shed some light on this for us. Hello there, Dr. Birnbaum.
Hi, how are you?
Welcome.
Thank you.
So one of his ex-lovers now is saying he told her he was planning a spectacular gesture. He feared that he would never, have his dream job, that he wouldn't be able to be a pilot any longer. He said, one day the world will know my name. These are the things that are just coming out now. What's your take on this?
Oh, it's devastating to say the least. And there's a name for this. It's called pseudo-commando.
Mm-hmm.
And this is driven by strong feelings of anger and resentment, feelings of being persecuted or grossly mistreated, and then it becomes payback time. So this fits right into his pattern.
Is there any way that you can predict this kind of behavior?
That's an excellent question, and it's extremely difficult to predict this because these people, even during mass murdering, they're very calm. They're contented, and they've planned this for a while. So it's almost as if they're finally fulfilling their fantasy of revenge.
Now, are they people without a conscience? Are they sociopaths? Do they have frontal lobe problems, not feeling any empathy for others?
That's also true. Psychotic behavior leads to a broken reality, and that's part of this pattern that this pilot had. So he hid his illness from the airlines. He tore up medical papers, as you know, and he was required to have these regular checks, and he didn't have to do any of this because everything was unknown.
Well, I mean, the airline did know that he had a history of depression. He had stopped his pilot training in 2008 because he was depressed and suffering burnout. So they were familiar that with the fact that he did have some mental issues.
That's true. I'm sorry to interrupt, but that was at one time. But what happened after that?
Right. Now, should airline pilots be excluded from flying if they have a history of depression and mental illnesses?
That's a fantastic idea, and the answer is absolutely. Why take a chance with all these people's lives? We have to be much stricter. We have to reinforce rules that are going to be very, very positive, that we will never have to worry about someone's history or their medical or mental history.
Now, what happened? How is this kind of a human being created? Is this something you're born with? Is this something that, is, how much is nature, how much is nurture here?
Well, depression can be one of several things. If you're predispositioned for it genetically, that's something that's biological and it's chemically induced. And that's often called clinical depression. And then there are other kinds of depression that occur to many people from events, from breaking up in relationships, hardships at work, or whatever there is that creates stress factors in your life. And those depressive episodes often leave, but they can come back again. And so there's no shame in this, and I need to tell your listeners that if they have any problems, there is help, and they can go ahead and take care of it. But then often these things do come back, and that's when we have to be alerted to different kind of professions where people are responsible for others.
Now, what kind of help could somebody like this get?
Well, first of all, you have to understand that he had just broken up or had broken up with his relationship. So right away there's a pattern there. There's a pattern that he had mental difficulties. I don't want to say mental illness because depression is really medical more than mental, and it's something that can be cured. So he was going through a dilemma in his life. What people need to know that these dilemmas are not consistent, and time does heal, and eventually something will go in another direction. Just like happiness is not a consistent either, and when people feel that they're supposed to be happy all the time, that's also a problem. Things come in and out of our lives, and our moods do change. With someone like this airline pilot, he had a history of reoccurrent depressive episodes. And with something like that, therapy or medication, and sometimes both, are the best treatments for these depressive episodes.
Now, we've seen in recent years so many men who become what you call pseudo-commando and murder groups of individuals in various ways, whether they're in schools or, in Norway. They went, was it Norway or Denmark, the guy who went in and killed all those kids at the camp?
Yes.
This person on the German Wings flight. But time and time again, there are these young men, and most of them seem to be young men, who have these breaks and, as you said, in a very calm fashion, murder many, many people. What is it about the male brain that it seems to be men who do this and not women?
Well, these are mortally injured people. They have a very low self-sense, lack of self-esteem. And so, therefore, men often have not been given the opportunity to work things through. They're supposed to be able to handle life, even at a very young age. And that's why it's more of a population with men than females who have opportunities to bond with other people and to speak and to fix and to cure. Men are often isolated, and young men as well, and this needs to be changed. We need to be able to raise our children in such a way that no matter what their gender is, that they're treated in a similar way.
And how do we do that? I mean, I know certainly, women do, as you said, have each other, and they talk a lot more, and we have daytime TV. I mean, we have The View. There are outlets for us to listen to other people's stories, to talk about the problems that we have, to talk about our frustrations, to talk about our pain. And as you said, those don't exist for men. But is there something that is different in terms of the hormones? Does testosterone, for instance, create this more aggressive behavior?
That is true, but our society is changing for the better in that direction, and men have become more nurturing and are bonding with their children and in their relationships. So it is going in a better direction. But often households do bring up their children differently. And when someone is silent, and this person was Andrea Lubitz, was silent. He was very quiet. Often when that happens, you're keeping things inside yourself. When you keep things inside yourself, tension comes out, because depression is anger turned inside you. So we need to be able to speak to our children in ways that they feel comfortable expressing themselves. And it doesn't really matter what you speak about, the littlest thing, because it's a trust issue. Eventually, when big things do come up, they will be able to speak to you in just as much a comfortable manner as they did when they spoke about small incidental things.
So your advice is for people to have conversations with their sons and their daughters if they're shy, if they're quiet, if they're having issues, and not to ignore it.
My advice is to have the opportunity to let your children know that changes can be made, that they have the answers, and to give them strength, because other people do not mold who they are. They need to be able to have a path of their own, that they feel that they're strong enough to make a difference, to be productive in life, to have a good sense of yourself, to have people around you, to be able to connect. All these contributing factors make a difference with depression.
Dr. Frieda Birnbaum, thank you so much
my
for calling.
pleasure. Okay, bye-bye.
Thank you. Thank you.